Hello there. My name is Jafar Nasirli and my co-worker is Nasibova. So I would like to make this presentation about the use of the Dexmedetomidine for pain relief after endoprosthetic surgery in patients with various types of the Coxarthrosis. So brief background: pain syndrome in patients with various types of the Coxarthrosis after endoprosthetics is an urgent problem that is far from a final solution. The main purpose of the study is the use of the Dexmedetomidine to optimize the perioperative pain relief in patients after major joint replacement. The material and research methods of the study is briefly described as the study was conducted in the surgical clinic at the MEU, which stands for the Azerbaijan Medical University. The study included 89 patients who underwent endoprosthetics in patients with a various type of the Coxarthrosis. Inclusion criteria were aged between 45 and 95 years old. An American Society of Anesthesiologists, which stands for ACA, physical status class from first group up to third group. All patients underwent general anesthesia. The patients were divided into two groups. In patients of group 1, surgical interventions were performed only under general anesthesia. And in group 2, Dexmedetomidine was included in the general anesthesia regime. In group 2, patients received demedetomidine at the dose of 1 mcg per kilogram for a 10 minutes loading dose, and then 0.2 from 0.2 up to 0.7 mcg per hour for a maintenance dose. Also, pain severity was determined using a numeric rating scale, which is stands for VAS, ranging from 0, which is no pain, to 10, which is up to the highest level of the pain. If the patient reported pain at the surgical site at the greater than 3, there is an intravenous mixture was started that included 50 mg of fentanyl in 50 mg of which is 0.9 saline at a rate of 1 mg per hour with a bonus dose of 1 mg. The time to the first complaint of pain was recorded at the patient with a VAS score of more than 3 points were administered the narcotic analgesic trimeperidine of 20 mg. Despite the protocol for the administration of analgesics, if the patient complained about the pain of more severe than VAS pain score of more than 4 points, trimeperidine 20 mg was administered intravenously. The quality of pain was assessed at 8, 16, and 24 hours after surgery. As a result, patients' characteristics were comparable between the two groups. The postoperative cumulative dose of intravenous trimeperidine was significantly lower in a group of patients whose anesthesia regime included dexmedetomidine that ranging from 0.1 up to 8 mg, than in the group with a dexmedetomidine starting from 10.3 up to 12.5 mg at a 16 hours. Median difference 7.83, and the last one at 24 hours, which was the 5.72 mg. Postoperative consumption of the non-opioid analgesics was comparable between the two groups. As a conclusion, intravenous dexmedetomidine significantly reduced the postoperative opioid using during the first 24 hours after surgery, and increased the duration of postoperative pain relief in a patient undergoing surgery for a large joint arthrosis. Thank you for interest.